We are live by YouTube.
Okay, we'd like to start the next meeting, so if we could get everyone situated, please. All right, thank you. Welcome to the October 18th Health Services Committee meeting. And first thing on the agenda is we need a motion to approve last month's minutes. So someone like to make that motion. Supervisor McDevitt, seconded by Supervisor Stroud. Any additions or corrections to the minutes? All right, if not, then we'll vote on all those in favor.
Aye.
Aye. Opposed? Carried. Thank you. Janelle?
Good morning, everybody.
Good morning. How are you today?
Tired.
I bet you are. Okay. Rough weekend, huh?
Absolutely. So my first resolution request is to authorize health services to enter an agreement with the state health department and HRI, Health Research Inc., to accept $980,544 grant funding for the Public Health Core Fellowship Program for the contract period starting December 1st of 2021 to go to July 31st of 2023, allowing for extensions and funding as available. Public Health Core Fellowship Program provides the opportunity to build the public health workforce and infrastructure, and this funding is provided by the State Department of Health through the CDC, through the epidemiologic and laboratory capacity for prevention and control of emerging infectious diseases in New York State. And it's a cooperative agreement for emergency response, public health crisis response 2018, and all the fancy numbers there. In reality, what we're getting is funding to allow for fellows in our community to learn public health so that they can become part of the workforce.
All right, thank you. Would someone like to bring a motion to the floor? Supervisor Hogan, seconded by Supervisor McDevitt. Any questions? Yes, Supervisor Hogan.
Janelle, I think this is pretty exciting. I'm particularly looking forward to the section where it says you're developing strategies to build trust, community relations, and methods to engage with local and underserved communities. As you know, we've had a lot of conversations about exactly that, and I'm really, really excited about this. So thank you for finding this opportunity and pursuing it.
All right, thank you. Anyone else? All right, then let's vote. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
All right, resolution request 2 is kind of a follow-up to 1. It's looking to authorize health services to enter an agreement with Hudson Headwaters Health Network as a subcontractor and subrecipient of the New York State Department of Health, Health Research, Inc. Public Health Core Fellowship Program in accordance with the outline grant requirements to perform the required deliverables and receive funding not to exceed the amount of the grant, which is $980,544 for the entire grant period, including any extensions. While Health Services fully supports our Public Health Core Fellowship Program, with current COVID response efforts and space limitations, our local health department's not able to commit. So we reached out to our partners, and Hudson Headwaters, who does serve a lot of the areas in need, has very willingly agreed to help us with the grant deliverables, working very closely with public health as an extension of public health to provide the opportunity to help us train this public health resource. So the intention of this agreement is that Hudson Headwaters will ensure the grant requirements are completed and will receive the allowed compensation. This agreement will be at no cost to the county, and all expenses are going to be covered under the state health department grant.
All right, thank you. Would someone like to make a motion for that one? Supervisor Strauss, seconded by Supervisor McDevitt. Any questions for Janelle on that? All right, then we'll vote. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
More good news for the county. Resolution request number 3 to amend our New York State Department of Health Immunization COVID-19 vaccine grant contract with the number indicated there in the parentheses from 1/1/2021 to 6/30/2021, not to exceed $183,683.11, to reflect the receipt of additional funding of $112,840.78. We received notification of this additional funding, which will be used to support COVID-19 vaccine administration with equity and to implement vaccine confidence strategies for COVID-19 with, COVID-19 and other routine vaccinations.
All right, thank you. Someone like to make the motion to approve that? Supervisor Strauss, seconded by Supervisor Hogan. Any questions? All right, if not, then we'll vote on that. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. All right, Janelle, we'll move along.
And just a quick aside note on the resolution request number 3, we've been working with Don Lehman and Washington County, and Be in Communications is donating some time and expertise in helping us come up with advertising campaigns. So we're anticipating a lot of that money will be spent in advertisement.
Okay, very good. Thank you.
So resolution 4, 5, and 6 kind of are on the same theme. Resolution 4 and 5 are particularly with the same agency, but we have a home care and a public health. So one is for one and one is for the other. So resolution request number 4 is to amend resolution 122 of 2019 to correct and clarify authorization to execute further amendment agreements with Waystar and Zermed for aforesaid services without the need for future resolutions, as long as there is no more than a 5% annual increase rate in a form approved by the county attorney. This contract is renewed annually for the purpose of verifying insurance before billing to expedite our claims without denials. The contract requires an annual renewal, and prior resolution was sought authorizing that annual renewal as long as the annual rate increase did not exceed 5%. However, in the actual resolution, it reflected an overall increase versus an annual. So we're looking to clear that up.
All right, thank you. Would someone like to make the motion then for that? Supervisor Hogan, seconded by,
Can I move 4, 5, and 6 all together?
is there a problem with that, Janelle? Can we put 4, 5, and 6 together? Or I should ask Amanda too. Is there a problem with putting those 3 together? No, all right, then that's what we'll do. We'll put the 3 of those together. That's all right with you, Mr. Stroud? All right, seconded by Supervisor Hogan. Any questions, though? All right, all those in favor, we'll vote on that then. All those in favor?
Aye.
Aye.
Aye. Opposed? Carried. Thank you.
All right, thank you very much for that. And we're up to resolution request number 7, and I will turn the floor over to Ton.
Attachment number 7 is for the fellowship grant that we talked about. It's to move the money. We're putting it into contract services, which is what Janelle said was going to be with Hudson Headwaters.
Right.
They will bill us and we will pay the bills to this, or forward them to the state. And then we put some in miscellaneous, as Janelle was saying, we don't have the space here. So if they have to buy, I don't know what, we were saying like desks or computers or something. Right now, we have no idea. So I'm putting it into miscellaneous right now, and I will move the funds if need be when the time comes. So that's what attachment number 7 is.
All right, so would someone like to make the motion for that one to amend the budget? Supervisor Strauss, seconded by Supervisor Hogan. Any questions? All right, and all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. All right, on.
Okay, attachment number 8 is the second one that Janelle had talked about regarding additional funding. We got the first notice of a little over 70,000 back in August, and we notified you in September when we got it. Now this part, we're again putting most of this in advertising. You see, as she had stated, working with local people trying to get the word out about vaccinations. So that's what attachment 8 is for the $112,840.78.
All right, thank you, John. Would someone like to bring that motion to the floor? Supervisor Stroud, seconded by Supervisor McDevitt. Any discussion on that? All right, we'll vote on it then. All those in favor?
Aye.
Aye.
Aye. Opposed? Carried. Thank you. John, we'll go on to number 9 then.
Yep, attachment number 9 is transfer of funds. The first part is expense for part-time salaries that this was a grant we had, which was 14,105. It was the first IEP grant, and we were able to find out that we were able to utilize it towards our nurses that we hired to help with the COVID clinics. So because we had put it in all different categories, I'm just moving it into the categories for salaries to pay for that. So that's what the first reclass or transfer is. And the second one is regarding right now in our disease program, we are over in salaries and part-time and overtime due to all the COVID activity. So we're just moving the money from our home care, which is where right now we have some extra money. We're not asking the county for any extra funds. We want to move the money over with some benefits. I will say with the hopes, because of this IEP grant, we just got some of this money. And again, we just got notified of these grants, but they are making them retro back to January. So I've got to go back and recreate the wheel here a little bit. But right now, if I can then claim more of the nursing time for the COVID clinics, which I'm sure I can, I'm going to reclass funds again internally when I pay it. But at least for now, to cover that negative number that's there, I don't want it to keep looking like we do have the funds to go ahead and offset that. So I'm asking to transfer those funds too. So our total is $101,688.54.
All right, thanks for that explanation. All right, would someone like to make a motion for that transfer, please? Supervisor Hogan, seconded by Supervisor Stroud. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Thank you, Colin. We have
Okay, on to attachment number 10, which is our financials. Again, giving you an idea where we stood as of October 4th when these were prepared. We are in the midst of trying to close our September billing for the home care. I did accrue some WIC revenues in there of 47,000, but on the bottom half where you see salaries, you'll see at this point, we are at 62.64% of our budget. As of October 4th, and last year at this time, we were at 71.63. So in that regards, we're, doing better in percentage wise compared to last year for our total salaries. And then attachment number 11 is again comparing last year to this year. And you'll see again the salaries information that we said, nothing with the equipment. I've already explained that in past months. It was basically vehicles. Contractual, and our benefits are down a little bit because we have positions not filled, so those benefits have not been taken.
Anyone have any any questions on attachment 10 or attachment 11?
No.
Okay, we're good, and we'll move along. Thank you.
Next, attachments 12A and 12B are the referrals for our home care. 12A is the one primarily I was looking at. We do tend to compare, and I was told Valerie, I talked to Val, who's the assistant director of home care. August of last year, we had a total number of visits of 1,191, and this year we had 995. However, what she really says to compare is compare the last month to this month. So if you look at the bottom, you'll see our skilled nursing visits, for example, went up in August. Our PT visits went down. We have noticed some PT visits, and she was saying that, some insurances will only allow so many visits. So when they have a managed care insurance, they will only allow so many visits. So that's reduced it. And at this point, we don't have an MSW, and we do have some parts of the area that we don't have therapy coverage. So if we get a referral for either of those areas, since we don't have the coverage, we can't take that referral. So again, that reduces the referral and reduces the visits for the therapy. So we just wanted to bring that to your attention as we work on that. And then 12B just breaks it out again for you all with by each town and city.
We appreciate that. Thank you.
And that's all I have.
All right, back to Janelle then.
All right, the next attachment we have is number 13, which is our emergency response and preparedness activities. Most of those all COVID related. We have been working with the schools with the testing. We recently had a quadrant training. Quadrant is the lab that at our last meeting that we asked for a contract with. They provided training for the schools in the county, and some of the local providers sat in just so everybody would understand the process. Also, we have our rabies report that's included. And our next rabies clinic is November 6th at the Queensberry Community Center from 10 to 12 for anybody that's interested. That is a free clinic. We do ask for a donation, but nobody's turned away. Jumping right along to our meeting and conference authorizations, right after our last committee meeting, we had notification of a home care emergency preparedness meeting that we are required as a condition of participation to attend. That was held October 6th virtually, and we received the necessary approval, which is attachment 15 for that. And we don't have any pending items. And the next is the privilege of the floor. Would you like me to go into COVID first, or would you like to see if anybody has any questions first?
All right. Anyone on the committee have any questions? All right, anybody else that's in the boardroom? No, I think then Janelle will move on to the COVID.
Okay, I know that everybody is getting very COVID tired, COVID cranky, COVID sick, and all the above, but we still down in public health are working hard every day, 7 days a week to respond to cases, provide outreach education, do testing, do vaccinations. With that, we have a couple clinics coming up. We were at SUNY Adirondack, or we're going to be at SUNY Adirondack today. From 12:30 to 1:30, and we'll have Pfizer vaccine at that clinic. We're at the Warren County Human Services building tomorrow from 4:30 to 6:30. We'll have all three of the vaccines there, J&J, Moderna, and Pfizer. We'll be doing first doses, second doses, additional doses, and booster doses. Just to note there, though, we're not going to be doing booster doses for Moderna. We're still waiting on the state guidance and the logistics to fall into place before we're able to do that. I anticipate within 2 weeks we'll be able to do that, but we have to wait for the new standing order and, you know, the state guidance before we can proceed with that. We also are going to be at Glens Falls Middle School October 22nd and Tuesday, October 26th. We'll be doing second dose booster Pfizer vaccines. This is posted on our website, by the way. We'll be at North Warren School October 25th for first dose and booster of Pfizer. And then at the Warren County Human Services building again from 4:30 to 6:30 with all three of our vaccines for first dose, second dose, additional, and booster doses. So, you know, vaccine's a very good idea. I'm still shooting for 100% in Warren County. Right now, we've got 68.4% of people that have completed the vaccine in Warren County as far as residents. As far as completing one dose, we're at 72.5% for people that have had at least one, compared to the state 70.4%. And if you look at 18 and older, we're at 83.7%. I mean, we're doing well, but not well enough. So we still need to encourage people to get vaccinated. As far as cases, they're not going down. We had hoped by mid-October, we'd start to see a little decrescendo there. Over the weekend, we had 30 and 36. That's a lot for weekend staffing. Currently, we have, well, as of yesterday, we had 36 reported. We don't have a number yet today. But we have 444 people in quarantine, and those are people that we continue to call every day. I'm just asking people to continue as we go into the holidays and all these other events. If they're indoors, please mask. We're looking at mask, distancing, and testing being our three things that we have that we can do to protect ourselves. And you throw in vaccination, that just makes it that much better. So if you're looking at somebody that's vaccinated, that goes indoors and they mask, they distance, and then if they test, you know, because they've been part of an event, you know, you're just looking at quicker identification and maybe the limit of exposure to other people. And that would just be my recommendation there. Right now we have 2 facilities that we're working with that have outbreaks that you're probably aware of. And that is what I have for now, unless people have questions.
Does anyone on the committee have any questions? All I want to say, Janelle, is thank you and your team for all the hard work. I just can't imagine the hours that all of you are putting in, but we certainly do appreciate it, and we want you to know that. So thank you.
I really think our staff are doing a great job. I know you know that, but I need to do a better job and find time to tell the staff that, because I mean, they don't ask for lunches, they don't ask for dinners, they don't ask what time they're going home. They stay till the work is done. And, you know, we're going to work on boundaries a little bit and try to free up some time for them to maybe, you know, have a little extra time for their families. So thank you.
Thank you. Make sure we need to work on that. That's for sure. Mr. Lehman, do we have anything from the public?
Good morning, Chairwoman Frazier. No, nothing on YouTube.
All right, thank you very much. If no one on the committee has anything, then I'll entertain a motion to adjourn. Supervisor Stroud, seconded by Supervisor McDevitt.